Good day, my name is Marcia, and today we're talking about the 4 biggest mistakes to avoid when studying for the NCLEX-RN. Are you preparing for the NCLEX-RN and feeling overwhelmed by all the advice out there? Don't worry, you're not alone. The NCLEX is your key to becoming a registered nurse, and avoiding these common pitfalls will help you study smarter, feel more confident, and make the most of your preparation time. In this video, we'll uncover the top 4 mistakes to steer clear of so you can head into test day with confidence. Let's dive straight in. Mistake 1. Overloading your study schedule. The first mistake is trying to do too much in too little time. Many students cram for hours, thinking the more they study, the better they'll do. But here's the truth. The NCLEX isn't just about memorizing, it's about critical thinking. Overloading your schedule can lead to burnout and actually decrease your retention. How to avoid it? Stick to a realistic, focused study plan. Limit your sessions to manageable blocks, like 2 to 3 hours, with breaks in between, and prioritize quality over quantity. This keeps your mind fresh and your focus sharp. Mistake 2. Skipping practice. Questions after mastering concepts. The second mistake is mastering the concepts, but then skipping practice questions. It's one thing to understand the content, but the NCLEX tests how well you can apply it in real-world scenarios. Without consistent practice, you miss the chance to see how questions are framed and how different topics are linked together. How to avoid it? Once you've built a solid foundation of the concepts, start integrating practice questions into your study routine. Aim to do at least 75 to 100 questions daily, focusing on understanding how each question connects to the underlying concept and why the correct answer is right. This will help you identify patterns in the test design and improve your critical thinking skills. Mistake 3. Ignoring your weak areas. Here's a mistake that can be a game changer if corrected. Avoiding topics you're weak in. It's tempting to keep reviewing the subjects you're already good at because it feels reassuring, but ignoring your weak areas can cost you on test day. How to avoid it? Identify your weak areas early, whether it's pharmacology, pediatrics, or prioritization, and spend extra time strengthening them. Use targeted resources like flashcards, study guides, or even tutoring if needed. Conquering these weaknesses builds your confidence across the board. Mistake 4. Jumping into practice questions. Too soon. Lastly, a major mistake is diving straight into practice questions without fully understanding the concepts first. This approach often leads to frustration and wasted time, as you won't be able to analyze the questions effectively or grasp the rationale behind the answers. How to avoid it? Before starting practice questions, ensure you've thoroughly reviewed and mastered the fundamental concepts. Use your study guides, textbooks, or video lectures to build a strong foundation. Then, when you begin practicing questions, you'll be better equipped to link them back to the concepts and recognize how the questions are created. To sum up, the NCLEX-RN is tough, but avoiding these 4 mistakes, overloading your schedule, skipping practice questions after mastering concepts, ignoring your weak areas, and jumping into practice questions too soon, will set you up for success. Remember, smart preparation isn't about doing more, it's about doing the right things. Now take a deep breath, stick to your plan, and believe in yourself. You've got this. And if you found this video helpful, hit the like button, subscribe for more tips, and share it with a friend who's also preparing for the NCLEX. Good luck. You're going to crush it.